Is medical marijuana a legitimate medical treatment? In this video, I'll share some important information, statistics, and research to help answer this question. I'm Dr. Michael Morgenstern with DRMTV. On this new channel, we provide health information you won't find anywhere else. So if you're new here, consider subscribing. There's been a lot of excitement around marijuana lately. 30 states have legalized marijuana, and the majority of states have legalized medical marijuana. What does that even mean? Isn't medical marijuana an oxymoron?
Bogus.
After all, isn't weed just something that people use to have a good time?
Smoke my weed.
Now they're saying it's a medical treatment. If it is, then why are dispensaries selling products called
King Kong?
Why do patients even go to dispensaries that don't seem medical, or even professional for that matter? Why can't every doctor prescribe it? These were some of the questions I had when I heard medical marijuana was legalized in New York. I thought some of my patients might benefit from it, especially those with chronic pain. But before I could recommend it to any of them, I needed some answers. Like, if I recommend this to my patients, will I be violating the Hippocratic Oath that says, first, do no harm? It turns out there's a wide body of research that supports its use. In 2017, a task force of the National Academy of Science, Engineering, and Medicine reviewed evidence of the health effects of cannabis to determine just how convincing the evidence is that it works. In their report, they concluded there's strong evidence that medical marijuana works for chronic pain, spasticity, and nausea. Moderate evidence that it helps with sleep, and some evidence that it works for anxiety. This review included 28 clinical trials for pain, 28 clinical trials for nausea and vomiting, and 14 trials for spasticity or muscle spasms. Some people question whether that was enough evidence, but you have to take things in context. Many people assume that all of the FDA-approved medications have been proven to be safe and effective, and that there's even more evidence showing that. But that isn't always the case. Do you know what the average number of trials are for an FDA-approved medication? 2. 2 trials, with an average of 760 patients studied. Nearly 40% of medications approved by the FDA are on the basis of just 1 trial. If this is the case, why isn't marijuana, which apparently has so much more clinical evidence, an approved medication? Why do some reputable doctors and scientists even oppose its use? One key reason is that there's a difference between the products tested in research and what actually is available today as medical marijuana in dispensaries. Research on marijuana has taken place over many years, and it's voluminous, but wasn't testing just one product. It was testing a bunch of different medications in the marijuana family, a whole class of medications, or a team or a family of medications. Some studies had high THC strains being tested, others low THC. Some had CBD strains, and others included different ingredients. A lot of the research doesn't even label exactly what's being tested or what other ingredients are included in the cannabis product that was being tested. In other words, the marijuana that was studied in research varied between studies and is different than the marijuana available in dispensaries today. This limits what we can conclude from all of this research. We can say that the family of medications work, but it's difficult to say that any particular product or strain that's available in a dispensary will provide the same results that we saw in research. In case this is a bit confusing, here's an example that might help. The 1995 Chicago Bulls was one of the greatest basketball teams of all time. Their leader, arguably the best player of all time, Michael Jordan.
The inbounds pass comes into Jordan. Here's Michael at the foul line. A shot on Elo. Good! The Bulls win it! They win it!
If you had to choose a team to compete against any other team in that year, you'd choose the Bulls, of course. What if you had to choose just one player from the Bulls to win in a one-on-one game? Well, you'd choose Michael Jordan. No doubt about that. He was their best player, and their best player by far. But imagine you didn't know what he looked like, or the name of any player on the team for that matter. and you're given a picture, and you have to choose one player. You might pick the wrong player. You might lose. You might pick this guy, who never averaged more than 3 points a game. That's similar to the situation we have with medical marijuana. We know it works well as a class or a team, but we don't necessarily know which individual team member is going to work best. Even though the class as a whole may be a superstar, it's difficult to say that about any one individual team member of the marijuana team. In the context of medications, that also could mean we don't fully understand what the side effects of any particular strain of marijuana might be, or how that might interact with other medications, or what kind of long-term effects it might have, or could be dangerous. We've seen this with some strains already, such as K2 or Spice.
It's synthetic marijuana. On the street, it's called Spice or K2, and it's showing up in neighborhoods across the nation, turning people like these into zombies.
It leaves us in a little bit of a weird situation. We're left with a family of medication or a team of medication in medical marijuana that we know really works well for certain conditions, but without a specific strain or team member that we know is really good. That doesn't mean we can't conclude anything from all of the research that we have. For example, we could compare marijuana as a class to another class of medications for a particular disorder. We could say, for example, marijuana as a class is better to use for pain than opioids, especially when you consider the benefits and the risks of both classes. But we might not be able to say that the strain called King Kong works better than the opioid known as Percocet. That's why medical marijuana is a legitimate treatment, but also considered an alternative treatment. Why, even though there's more research showing it works for some things like pain than other FDA-approved treatments, as a class or as a team, it still isn't an FDA-approved medication available in pharmacies. As a patient, the best thing and safest thing to do is to try conventional medications first, and before using any marijuana, consulting with a physician who specializes in it, because there's always the chance of selecting the wrong strain. That might not work, could have unknown long-term side effects, or could be dangerous. Is medical marijuana a legitimate medical treatment? You bet it is. As a class, it's a legitimate treatment. We just need more research before we can say without qualifications which strains or specific products work best for any particular conditions, and which ones don't or are more dangerous and have worse side effects. That will allow doctors to predictably and safely prescribe marijuana and make judgments about individual team members on that team, not just marijuana as a class. Until then, marijuana treatment should be an alternative treatment, closely supervised by a physician, even more so than other medications. But when traditional medications don't work, medical marijuana can be an all-star alternative treatment. And seeing a physician that knows about it can ensure that you're more likely to get the all-star rather than the dud. Here's the question of the day. Do you think that medical marijuana is a legitimate treatment? Why do you think it is? Or why do you think it isn't? Let me know in the comments section below. Remember, some of the best ideas come from the community, so make sure to connect with everyone in the comments section. Thanks so much for checking out this video. Hit the like button if this was helpful, and make sure to subscribe for more videos like this at DRMTV, bringing you vital information to improve your health that you won't hear anywhere else.